my name's Kristen. I'll be your student nurse today, okay? Okay, my number is 87 for this exam. Today you're here to do a musculoskeletal exam, okay? Okay, so I'm going to put this drape on you. I want to ensure that you're comfortable the whole time, okay? So if you ever have a question at all, just stop and let me know. And this will be confidential between me, you, and any healthcare provider, okay? Okay. Can you say your name and date of birth?
Crystal Brown, March 6, 1999.
Alright, awesome. So first, I'm just going to inspect your cervical spine. That's like the back of your neck. So I'm just going to have you put your chin to your chest. Right here. Alright, and I notice everything looks symmetrical, your paraspinal muscles, you have an even shoulder symmetry as well. I don't notice any rashes, lesions, any bulges, skin breakdown, anything like that. I'm going to go ahead and palpate a little bit, so just feel around. Let me know if you have any pain or tenderness, okay?
Okay.
Okay?
No.
Okay, awesome. And I didn't notice any edema, so that's good. So now I'm just going to have you put your chin to your chest again, okay? And then hyperextended is just looking back kind of at the sky, looking up. Perfect. And then if you would go side to side for me. Alrighty, awesome. And then the next one is just putting your ear to your shoulder without putting your shoulder up to your ear. Good, perfect. Next, I'm just going to inspect your temporomandibular joint here. So I'm just going to move your hair out. And I don't notice any bulging, rashes, lesions. Looks symmetrical on both sides. I'm going to go ahead and palpate. Let me know if you have any pain or tenderness, okay? No pain?
No.
Okay, and there's no swelling that I noticed, so that's good. Next, I'm going to have to do a few movements of your jaw. So I'm going to have you open and close it. Okay, and then move it side to side. And then protract is bring it out and retract back. Perfect. You've got good range of motion with both your head, neck movement, and your jaw, so that's good. Next, I'm just going to inspect your sternoclavicle joint here. So I don't notice any rashes, lesions. It looks symmetrical on both sides, which is good, and I don't see any abnormal bulges. I'm going to go ahead and palpate. Let me know if you have any pain, tenderness, or tingling. All good?
Yep.
Okay, and then there's no swelling there as well. So next, we're going to move on to your lower extremity, or your upper extremities, pardon me, which is your arms. Just going to do a general inspection of your shoulders, down to your elbows, to your wrists, hands, fingers. I notice it's all even color. Everything looks symmetrical on both sides. I'm not seeing any rashes, lesions, skin breakdowns, nodules, anything like that. I'm going to do a general palpation. Let me know if you have any pain or tenderness, okay? Alright, no pain or tenderness? Perfect. And I didn't notice any edema or rashes, lesions, of course. So next we're going to move into range of motion exercises. We're going to start with your shoulder. So if you just kind of bring them down to your side, this is called extension. Flexion is if you bring them up to the air. Perfect. And then hyperextension is bringing them behind your back. Perfect. Alright, and then next we will abduct, so just bring them out to your side. And adduction is cross them over your midline. Perfect. And then the last two for shoulders is internally rotation, so I think of a field goal. And then externally rotation, kind of as if you're getting handcuffed. Perfect. So next I'm going to apply some resistance to these, okay? So I'm going to have you flex your arms up and don't let me pull them forward. Okay, and then you can extend down and don't let me pull it forward. Okay, if you'd hyperextend this one back, don't let me pull it forward. Good. And then abduct out to your side and don't let me push it down. And then adduct across your midline, and don't let me bring it out. Perfect. Next, we will internally rotate, and don't let me push it down. And externally rotate, and don't let me pull it out. Perfect. And we'll do the same thing on the other side. So if you flex it up, and don't let me push it down. And then extend it down, don't let me push it up. And hyperextend it, and push it up. And next you can abduct it, and don't let me push it down. And then adduct across your midline, don't let me pull it out. Okay, and then we can internally rotate this, and don't let me push it down, and externally rotate, and don't let me bring it back forward. Perfect. So that was good range of motion and muscle strength on those shoulders, so 5 out of 5 for those. Next, we're going to do your elbows. So if you just put them kind of out straight, that's extension, and then flex them up towards your face, that's flexion. And then if you have a 90-degree angle and this is called supination, and if you move your hands over it, that's pronation. So if you would extend them out for me, I'm going to do the muscle resistance, so don't let me bring it up, and then flex it, and don't let me bring it down. Good. And then supinate, just don't let me pull it over, and pronate, and don't let me push it back over. Perfect. Do the other one, extend it out for me. Let me push it up, and flex it, and push it down, supinate, bring it down, and pronate, don't let me bring it back out. Perfect. So good range of motion on your elbows there, and strength 5 out of 5. Next, we'll move on to your wrists. So if you hold your wrist straight out, that's called extension. Flexion is moving the wrist down, and hyperextend is moving them back up. Perfect. For these ones, we can do radial towards your radius, so in the middle, and ulnar towards your ulnar bone. Perfect. And then, all right, we can apply some muscle resistance to these two. So you can flex them out or extend them out. Don't only push them down, and flex them. Don't only put them back up. Hyperextend. Don't only push them down. You can radial. Don't only pull them out, and ulnar. Don't only push them in. Perfect. And we'll do the same thing on this one. So that's extension. Don't only push it down. You can flex it down. Don't only push it up. And hyperextend. Don't only push it down. Okay, radial. Let me pull it out, and ulnar. Let me push it in. Perfect. So good range of motion on those as well, and muscle strength 5 out of 5. The next, before we move on to fingers, we're going to do a couple wrist tests, just a test for carpal tunnel syndrome. So the first one is called the Fallon's test. We're going to move both your dorsal sides of your hands together as this for about 60 seconds. And I'm going to time it, and anytime you feel pain, numbness, tingling, if you do it all, just let me know. Doing okay?
Yep.
About halfway there. Alright, just a few more seconds. The next test we're going to do, I'm just going to support your wrist like this and tap on some median nerves here. And if you feel any numbness or tingling, just let me know. Any pain, numbness? Perfect. Nothing there? Okay, perfect. Next, we are going to do range of motion on your fingers. So it's kind of like the wrist. If you just extend them out, that's extension. Flexion, at the knuckles. Hyperextension. And then this one, to abduct, you make a fist, adduct, and to abduct, you fan out. Perfect. So we will extend them, don't let me push them down, and then flex them down, don't let me push them up. Hyperextend, don't let me push them down, and then you can abduct them, don't let me pull them together, and then adduct, don't let me pull them out. Okay, then we'll check the other hand. So extend them out, don't let me push them down, and flex them down, don't let me push them back up, and hyperextend, don't let me push them down. And then you can fan out to abduct, don't let me pull them together, and adduct, don't let me pull them out. Perfect. So that was good range of motion for your shoulders, elbows, wrists, and fingers, and muscle strength 5 out of 5 for your shoulders, elbows, wrists, and fingers. Next, we're going to move on to your lower extremities, so I'm just going to have you lay back the head of bed for an increase here. Put something up for your feet. Alright, and I'm going to do a general inspection just as I did like the other time. This time I'm inspecting your trochanters, which are your hips, going down into your knees, down into your ankles, feet, and toes. And I don't notice any rashes, lesions. The area looks like it's an even color throughout. And I'm not noticing any skin breakdown. Everything looks symmetrical on my part as well. Next, I'm just going to do a general palpation over everything, so if you feel any numbness, tingling, pain, let me know. No pain? No. Okay, and I'm not noticing any edema, so that's good. Next, we are going to test your range of motion on your hips here, your trochanter's. So if you would flex it up, is your knee at 90, perfect. And then this straight out is extension. And then this one you can abduct towards me if you bring it to the side, and then adduct across your midline, perfect. And then also on this one is another internal rotation, so you can bring your knee up, and internal is towards you, drop it towards you, and then external is towards me. And then the last one on this is hyperextension, so if you lay on your side and then just bring your leg behind you, that's hyperextension, perfect. We can do the other side now. We'll start with that hyperextension. Perfect. And then this is extension, and if you flex it up, perfect. And then this one is abduct if you bring it towards that side, and adduct across your midline, perfect. And then internal rotation would be knee, and then bring it forward, and then bring it externally, that's external rotation. Perfect, so now we're gonna test with some muscle strength with my resistance. So I'm just gonna hold it here. Don't let me flex it up. Perfect. And then if you would flex it, don't let me bring it down. Perfect. If you would abduct it towards me, don't let me push it in. And adduct across your midline, don't let me pull it out. Next, you can internally rotate, so push your knee down and don't let me pull it out. And then externally rotate, don't let me push it in. All right, and then the last thing we'll do the hyperextension. And don't let me pull it in. Perfect. And next we'll do the other side. All right, and don't let me pull it in. Perfect. All right, and then this is extension, so don't let me pull it up. Okay, and if you would flex your knee up, don't let me push it down. Perfect. And then you can abduct that one, and don't let me bring it in. And then adduct across your midline, don't let me bring it out. Okay, and then the last two for this one is the internal rotation, so bring that knee up towards you, and do not let me push it, and then bring it out, and don't let me pull it back in. Perfect. Next, we're gonna do a straight leg test. So basically, I'm gonna support your leg and just try to keep it straight up the whole way, and if you feel any pain, just let me know. While we're up, I'm gonna have you flex your toes when we get up there. All right, so flex your toes towards you. Any pain at all? Perfect. We'll do the other one. Over here, bring your leg up and flex your toes for me. Perfect, any pain at all? Awesome. All right, next we are going to test the range of motion at your knees. So if you'd flex it up as a 90-degree angle, that is flexion, and then straighten it out but not all the way flat is extension. Then do the same thing on this one, flexion, and all the way out, extension. Perfect. So I'm gonna have you flex again, and don't let me push it down. And then extend, and don't let me bring it up. Perfect. And then flex that other one, don't let me bring it down, and extend it, and don't let me bring it up. Perfect. Now we've got a couple tests for like herniated discs. It's all to do with your knee real quick. There's 3 of them. The first one is the bulge test. So I'm just going to touch here 3 times, going up on the medial side, and touch on the lateral side, and I'm not noticing any extra fluid that would come as like a bulge on that side of your knee. I'm doing the same thing on this one 3 times. Touch the lateral side, and I didn't notice any fluid or bulges that came up, so that's good. And that means there's no extra fluid in there. The next test is the ballottement test. So I'm just gonna kind of milk down on your leg here, feel for any extra fluid, and push down on your patella. I don't notice any extra fluid, and I didn't notice any clicking sounds, so that's good. And do the same thing on this one. Don't feel any extra fluid, and no extra clicking sounds on the patella, so that's good. The last one is called the McMurray's test. So I'll have to walk you through this one, but you'll flex your knee up for me, and then we're gonna externally rotate, and then I'm gonna invert your foot. And then I'm just gonna straighten out your leg. If you feel any pain, let me know, okay? Any pain at all? All right, I'm gonna do the other leg. So have you flex it up. You can externally rotate and invert that foot, and then we're gonna straighten it out. Any pain at all? Okay, perfect. We're gonna have you set up now to do your ankles and your toes. All right, so your ankles. So plantar flexion, I'm gonna have you just press down on my foot as if you would a gas pedal. Okay, and then dorsiflex is up towards you. Perfect. And then this one you can do like your hands did, like a radial and ulnar. And then you can also, it's called inversion, where your big toe kind of goes up towards the ceiling or the sky. And same with the other one. Perfect. And then eversion is where your baby toes go up towards. Perfect. So next we're going to try it with some muscle resistance. So plantar flexion, plantar flexion is push down like a gas pedal and don't let me pull it up. And then dorsiflex up towards you, don't let me push it down. Perfect. And then you can radial, don't let me pull it out. And ulnar, don't let me push it in. Perfect. And then the last one was the inversion with your big toes up, don't let me bring them down. And then the eversion, don't let me bring it down. Perfect. Alrighty, so next with your toes, we are just going to flex them down as if you would your fingers. Perfect. And then extend them is kind of up towards you. Just your toes. Perfect. So you can go ahead and flex them down and don't let me bring them up. Okay, and then extend them up towards you and don't let me push them down. Perfect. So you had good range of motion on your trochanters, knees, ankles, and toes, and a muscle strength of 5 out of 5 out of your trochanters, knees, ankles, and toes. Next, I'm just going to look at your lumbar and thoracic spine. So I'm going to have you stand up for me. And I'm just going to have you bend over and touch your toes while I note the symmetry of your spine back here. Everything is even throughout. The color, I don't notice any rashes, lesions. I'm going to go ahead and palpate, okay? Let me know if there's any numbness, tingling, or pain. Any of that?
No.
Okay, perfect. You can come back up. And everything stayed even throughout, so that's good. I didn't notice any edema or rashes, lesions back there. So now we're going to have you, if you stand straight up, this is extension. And if you lean forward, that is flexion. And then lean back is hyperextension. Next, if you just move side to side, kind of like you're moving your hand down to your knee. Perfect. And then the last thing, if you keep your legs straight, we try to move your abdomen. Perfect. Good range of motion there as well. So that is all good. And then the last thing I need you to do is just walk for me, and I'm just going to notice a couple things. Just walk back and forth. Perfect. So you have a steady gait, nice balance. I see you have a medium wide base. You are stable the whole time, so equal stability. You have a long and even cadence. And while you're walking, your arms are opposing with your feet facing forward, so that is all good. Do you have any questions at all?
No.
Okay, I believe that comes to the end of our exam.